Healthcare professionals of Reddit, what is the most surprising thing that your patients don't know about their own health? Story 1. I have conversations like this daily. I'd like to go over your medical history with you. It says here you have a history of high blood pressure. Patient: no, that's wrong. Me: okay, I see on your medication list that you take hydralazine. What do you take that for? Patient: for my blood pressure. I used to have high blood pressure, but it's okay now. Facepalm. Story 2. Juice is not good for you. It's pretty much just sugar. I've seen tons of diabetics trying to be healthy by replacing all their soft drinks with juice. Edit posted this morning when I was heading out without too much time to clarify. So let me add a few things. First, yes, in general fruit is good for you. However, the best way to eat a fruit is how nature intended, by to piece off, chew it, and swallow. Why is this? Well, it turns out that the beneficial parts of fruit, its fiber and its micronutrients, are mostly tied up in the matrix pulp of the fruit and its rind, its skin. If you blend the fruit then filter these parts out, you're mostly just getting sugar. Unfortunately, this is common with a lot of processed juices that are available to consumers. Of course, it's even worse if the juice being sold is heavily diluted with additional non-fruit derived sugars. What about if I blend the whole fruit at home though? Well, this is definitely better, but still not ideal. Why? Well, fructose, the sugar found in fruits, is known as a simple sugar. This means that your body can rapidly metabolize it and dump it into your bloodstream versus complex sugars which enter the bloodstream much more slowly. In fact, this is the very reason why we offer orange juice to a person who just passed out. It rapidly elevates their blood sugar. Ideally, you don't want huge rapid spikes of sugar to hit your bloodstream chronically, day after day, since this is one of the early steps leading to type 2 diabetes. Naturally, eating fruits by chewing mitigates this downside since it physically takes you time to chew and swallow the fruit, spreading out the sugar delivery over several minutes. If, however, you blend the fruit, that same sugar load can hit your bloodstream over a much shorter time window. 1. Because you don't have to spend time chewing, and 2. The surface area of the swallowed food is much higher, allowing your digestive enzymes to immediately access the calories. What does this all mean? Well, that's up to you. The role of a healthcare provider is to educate you and then let you make the decision. For example, I like ice cream, but I know ice cream is not super good for me, so I weigh that in my decision making. That doesn't mean I don't eat ice cream. I just won't do something silly like try to go on an ice cream diet. Therefore, when it comes to fruit, I try to eat it without blending. But hey, if I'm sick and have a sore throat, I'll order a giant blended smoothie because it makes my throat feel better. Sometimes I drink orange juice because I like orange juice. Everyone should make their own decisions based on what matters to them. Story 3. EMT on a rural service. The bulk of our calls can be avoided if you just take your meds like you're supposed to. Also, if you're a diabetic, freaking eat something, stop skipping meals and calling us because you're dizzy. Story 4. Being overweight is bad for you. It might not be really affecting you right now, but it will. Being a normal weight isn't just for aesthetics. On top of that, people who don't care about what they're eating. Even if you're a thin normal weight, you won't be healthy if you're living on fatty, sugary foods. Even if you're only taking in a certain number of calories per day, and not gaining weight, you're missing out on a lot of nutritional value. Story 5. I do an HIV and syphilis study, and it's so surprising how many people don't think you can get STDs from oral. They wrap it up for yet don't think twice about giving and receiving oral unprotected. Story 6. The staggering amount of ignorance that people have about the effects of their obesity. I work in an orthopedics office, and almost every day we have patients who come in saying things like my knees hurt because of my anemia or the cartilage in my knees is worn out because I don't take my vitamins. No, you're 325 pounds and the joints in your body are not equipped to handle that. And somehow these people completely lack the self-awareness to see it. Story 7. I work at a rehab hospital where the goal is for the majority of patients is to return back to their lives after sickness, surgery, or illness. Usually the first 2 to 5 days of the hospital seems to be the hardest because they just left the hospital. But after about a week the therapists physical, occupational, speech, recreational, etc. really start working hard with these people to help them get back on their feet. However, there always seems to be this handful of patients that flat out refuse to participate. All they want to do is lay in bed and won't even attempt to get out of bed to relieve themselves, or even better not even try to use a bedside commode or bedpan, just lay in bed and pee on themselves all day long. And then call someone to clean them up, being fully aware that they prefer to themselves and have some clean them, instead of using the multitude of options we have to help relieve themselves. The kicker is most of the people who do these things are patients before the health decline, lived independently, drove, held a job full-time, have children at home, etc. Let me add that because of their lack of participation in the rehab programs or their lack of self-care, we can't discharge these patients to their homes, and instead may have to extend their rehab in a long-term care setting. And their families come to me and beg and cry and complain about their family members' lack of care and how they're just not improving, and they just cannot understand. So family member must be so sick that they cannot even use the bathroom. TLDR, you need to help yourself to get better. Okay, rant over. Source nurse. Story 8. My husband has a story he likes to tell of when he did a rotation in wound care. I think, possibly something different. There was a gentleman who was diabetic and having foot problems. He hadn't removed his shoe in a while, and when the resident removed it the patient's foot came with. TLDR patient didn't know that his foot had auto-amputated. Story 9. Teacher here. So I am not a medical professional, but seriously, your kid needs sleep. If they are tired, let them sleep. Don't drag them around at midnight because that's when your check came in. they should be in bed. Story 10 Old Man Strength. I work in a long-term care facility, and God, these old men who sit around doing nothing but being crazy all of a sudden wake up and literally toss a wheelchair out a window or flip some tables. It takes like 8 people to restrain them. Old man strength is real, it's scary. Story 11 Contacts and glasses are prescriptions. You can't just come in with an empty box of contacts and demand I need to sell you more. The curve and diameter of your eye are taken into account, and you can hurt your eye if you're using the wrong ones. If your eye doctor recommends that you see a specialist for glaucoma, cataracts, or something else, go to the specialist. Do you want to be blind? No, you probably don't. Edit the wrong glasses will give you a headache, and there's tentative links to it leading to early presbyopia. But neither of those things are severe, which is why you can buy them OTC. The wrong contacts can do a lot of bad to your eyes, like tearing your cornea or giving you an infection. Doctors and companies that dispense contacts can be sued if these things happen, and they didn't take precautions to make sure they got it as correct for you as possible. Story 12 That antibiotics should be taken for the full course. Yeah, that bad yeast infection that I have to now monitor and take cultures from is due to the fact that you stopped your antibiotics, kept the leftovers, and diagnosed yourself when you felt that you had the same sort of infection again. You don't do that. Take all your prescribed antibiotics. Story 13 Allergies to meds. I can't count the number of PTS I've asked are there any medications you're allergic to, and they can't answer it. They either don't know the difference between an allergy and a side effect, or don't know the name of the medication they're allergic to, and don't bother to wear a medical alert bracelet or anything. It's almost like they don't care. Story 14 Pharmacist here. The lack of dialogue between patient and provider is always concerning to me, and it can have pretty far-reaching consequences. I've seen people make the decision to have surgery or a painful, invasive test performed that really is unnecessary, but they trust the doctor so they do it no questions asked. You or someone you trust should spend at least a couple minutes going over every detail of every procedure before it's done. You should know why it's being performed, how it will help them care for you, and what the risks are for the procedure. The biggest issue I see a lot is spinal taps for infants. So many are performed and their utility is starting to become highly questionable. In terms of my profession pharmacy, I am always astounded that people don't know what medications they're on and why they're on them. When I have people that don't know they're on blood thinners or blood pressure medications, it boggles my mind. I strongly encourage everyone taking their meds to keep a list of them plus allergies, major surgeries, and all your doctors at all times and to update it regularly. Encourage your parents and grandparents to do the same thing. Help them if they need it. It is amazing the amount of errors and delays in therapy that can occur simply because of poor history. Story 15 A woman came in our clinic for a complete checkup as a requirement because she's going to work in another country. One of the requirements was an HIV test. While I was taking her blood, she asked me, "Is HIV still a thing? WTF?" Story 16 Your grandmother may or may not have died painlessly. If there are no obvious signs of struggle suffering, I and everyone I know tell the family the patient died painlessly. Story 17 As a formerly and currently pregnant lady who interacts with a lot of other pregnant ladies, I am regularly shocked by how many women do zero research on pregnancy, labor, and delivery. They just have no idea and no plan. You mention a birth plan and they're like, oh, is that something I'm supposed to do? Their birth plan was just to, I don't know, wait around at home until they were in excruciating pain or their water broke and then show up at the hospital and do whatever they're told. Their only research into pregnancy is whatever they've seen on TV and in movies. It blows my mind. Being pregnant and giving birth is pretty much the most important and most difficult thing that most of our bodies will ever do. Why would you not want to at least look into it? Edit Many people seem to be misunderstanding me because I use the word plan. I don't care if you didn't walk into the hospital with a 10-page birth plan detailing what you want the doctors to do in the event that the vending machine is sold out of Dr. Pepper. But if you walk into the hospital without even knowing what Pitocin is or knowing how many centimeters your cervix has to dilate before the baby can come out, then that's where you and I have a problem. This is a major thing that is happening within your body. Spend 5 minutes on Google before you do it for Chris sakes. Story 18 My mom is in pediatrics and it's appalling how stupid some of the parents are. I used to answer phones for her, take messages and such. One parent called and worried that her child was having an allergic reaction to something that necessitated an immediate callback. This is how that call went. Hi, this is Dr. Blackison's mom. What's going on? Oh well, little Johnny was eating a little while ago and when I came back he had this big rash on his face. It's all red around his mouth. What was he eating? Strawberries. Is he allergic to strawberries? No. Why don't you try wiping his face? She presumably wipes child's face. Oh gosh, it was just strawberry juice on his face. I'm so sorry to bother you. WTF. Story 19 I'm a pharmacist and have seen some pretty interesting patient logic scenarios, but I think some of my favorite include antibiotics. On more than one occasion I've had patients put a capsule into their child's ear canal for an ear infection. Story 20 Fluoride in water and toothpaste and the type we put on teeth is not to perform mind control, or poison you, or make you dumb, and your lack of use is why you have so many cavities. Story 21 Retail pharmacy tech here. Most people don't have any idea how their insurance works. They get these cards that have little magnetic strips on them, and it seems like every time they come to my store, they want to swipe it like a credit card and BM cheap drugs. What really happens is that we have to manually input the data into a computer, send a claim, they give us a yay or nay and how much to charge, usually with stuff like generic drugs. The price is reasonable, less than 10, most people don't argue with that. It only gets crazy when you start dealing with fancy brand name bullshit that doctors get sold into prescribing as a first-time trial than exploring less expensive alternatives. Case in point, proton pump inhibitors. For many years, Prilosec omeprazole was the go-to drug. Then AstraZeneca went full retard and started pushing Nexium esomeprazole, which they claimed to be better than the standard, but it was never necessarily proven to be so. In fact, the reason more people seem to think it works more is because the drug is double the strength of the standard. Regardless, we'd get insurance rejections for this all the time, especially when doctors think of this and only this when they first encounter a patient with acid reflux. They could have tried omeprazole, they could have even tried other over-the-counter stuff like Zantac, but no. They went with a drug that has a cash price of like $200 and sent them off. Now we, as pharmacies, have to deal with the standard, but I paid my insurance premiums, or why would you need the doctor's okay? He prescribed it, as if we were the ones that actively denied filling it. Now we have to get the doctor involved with calling the insurance company to explain his reasoning with going through with this fancy brand name drug, as opposed to going a less expensive route, which, depending on the doctor and how good their staff is, can take anywhere from an hour to a whole week. Nexium is now generic, but there's a ton of examples like this extending from blood pressure to cholesterol to diabetes to all kinds of medications. Doctors get sold on to these fancy brand name drugs that already accomplish what good generics have done for years, and there's little if any backing for a lot of these new ones. If you're just now being diagnosed with a condition, seek generics first. 95 they'll work fine and you want pay out for it. Then we get into deductibles. Oh me, the deductibles. Every January, I get to remind thousands of patients that it's the new year, and with the new year comes the new cycle on their plan. And if they picked a low premium high deductible plan, I'm in for a world of bullshit. You'll have people actively tell me to not run prescriptions through their insurance because they have to pay a deductible. That's really stupid, and hey race, why when your insurance company goes through the process of being accepted at pharmacies, they negotiate on their members' behalf for a price on a drug. So if you went to a pharmacy and paid out of pocket for the aforementioned Nexium, you'd pay $200 straight. If you let us bill your insurance and you're responsible for $100 of the cost due to your deductible, you'll probably end up only paying $120. This continues until you hit your maximum, and then you're off paying whatever brand name price you're responsible for. I'd also like to take this time to complain about pain patients. Look, I know you're in a heap of pain and it's difficult to live your life without them, but you need to look at the other side of the coin. A lot of these pain medications are controlled substances. Emphasis on control. We have to monitor days supply, directions, strength, everything. It's not because we love being dicks to our patients, though the sketchy ones that come in from out of nowhere with an absurd amount of oxycodone with no history of it are kind of funny to deal with. It's because we have a license to protect and can be fine-jailed for irresponsibly filling narcotics. A lot of pharmacies in my area will allow a 2-day early refill on most narcotics, though some doctors will absolutely not allow them to be refilled early at all. That 2-day window is pretty generous given the potential legal circumstances. That said, 99 of all the way too soon drugs I run into are always for pain meds and benzos. I dropped them in the toilet, I'm going out of town. They got stolen, though this is legit if you can produce a police report. My doctor increased my dose but didn't specify it on the prescription. It's funny how these excuses always pop up on drugs like these but never for maintenance drugs. I get that pain is a difficult thing to manage, but I really feel that a lot of my patients have given up trying to fix the problem that is causing the problem in the first place and are just popping pills because of it, and they don't see things from our perspective that we are dealing with legal entities and have to make the professional decision based on the information given to us. The key word with pain management is management. If your doctor wants you to be on no more than 6 pills a day, you should not be taking 10 of them a day and expect an early fill. If your pain is that agonizing that you need to exceed so many tablets, you need to find an alternative such as a different drug or surgical procedure to correct the issue. Also, to all you meth heads out there, don't come to the pharmacy with your shitty face tattoos and out-of-state ID cards all at once and line up to get 96-count Sudafed all in a row. I'm going to refuse the sales. TLDR, we don't get control of your insurance policies, and we have a license to protect, which is why we don't get to fill your controlled medications as often as you like. Story 22. As a pharm tech, I can tell you that 90 of the patients have no clue what they're getting or what it's for. I get multiple scripts all the time where they just say, can you tell me what the doctor prescribed me and what it's for? Either doctors aren't explaining anything or patients aren't listening. Also, a surprising amount of young adults and adults have a very limited idea of a lot of related things. I get a ton of questions about birth control, the Plan B pill, condoms, and their STD medications. I always love I just started taking these pills for my insert vaginal bacterial infection so I can still have right no. You should probably wait until you've cleared your medication regimen, and then some LOL. Story 23. I'm increasingly boggled by how many people don't know about what kind of health insurance they have and what it covers. People will walk into the clinic and expect everything to be paid for, and they hand me an insurance card with a $5,000 deductible. Lo and behold, they come back super angry when they get their bill. Or how many people ask me if I can call their insurance and figure it out for them? No, I can't do that because I'm not you, or the people who walk in, have never been seen there and don't have their insurance card and get mad at me. Why can't you just look it up? Ugh, sorry, end rant. Source: X-ray tech being forced to work front desk when it's slow. Story 24. As dentist, I can understand that diagnosing decay may be difficult. Examining yourself in a mirror is difficult, but what drives me crazy is when PTS come asking for whitening and be shocked when they are told that the hole in their front tooth is cavity. It's like your front tooth has a black hole in it. What could that possibly be? And how did you not think that something was wrong? Story 25. I work as an RN at a dialysis clinic. At this point in the USA from 1980 to 2009 ESRD end-stage renal disease has increased nearly 600%, from 290 to 1,738 cases per million. This is due to the fact that many Americans have little to no interest in eating a healthy diet, taking medications as prescribed, or exercising. The two main causes of ESRD are diabetes and high blood pressure. People, make sure you take care of your bodies, because you do not want to be in the situation my patients are in. Story 26. I work with a student who's on Latuda and 1. His mom didn't even know the correct pronunciation of the drug 2. She's not clear on whether her son has ADHD or bipolar disorder. It might be useful to know which condition he has. Story 27. Walk a lot more, drink more water and less alcohol, take a vitamin D tablet daily, and you'll begin to look and feel incredibly better within weeks. It really is that simple. Story 28. Not necessarily about their own health, but I had a patient come in who was very angry that she was pregnant despite being on a contraceptive. After talking to her for a few minutes, I found out that she had been taking her NuvaRing, cutting it up into 30 pieces, and swallowing 1 piece a day. I have also had a patient wear it as a bracelet. Story 29. In the UK at least, legal doesn't mean safe. So many deaths caused by people taking legal highs, they assume that if a substance isn't banned yet, it's safe to get high off it. In reality, some real-life Walter White has changed the molecular structure of some pretty nasty class A drugs and redefined them as plant food so that they are technically legal. Cannabis users, on the other hand, are criminals in the government's eyes, but that's an argument for a different forum. Story 30. I didn't know I wasn't supposed to take my wife's nitroglycerin medication whenever I had chest pain. She's my wife, so I know that the prescription is for both of us. Yes, they were old. Story 31. I had a patient that kept insisting that she needed Purell to clean her hands. We had hand sanitizer in gel and foam, and plenty of sinks with soap, but she angrily refused because she wanted Purell because it didn't have chemicals. Story 32. That smoking can lead to some serious awful problems. Yes, people are aware that it's not good for them, but sometimes they don't realize how bad it actually is for them either. I have a patient with terminal lung cancer, COPD hypoxia, on 4L/O2, and still says why did this happen to me, while puffing on a cig. Also, a lot of people don't realize how much their own motivation, confidence or family support contributes to their health. In Makota, in an acute long-term care facility, some people come in, have great attitudes, family pushing them to get better, and they have a great recovery and go home. Some come in alone, no family, no motivation, and even though all of us therapists, nursing techs are doing all we can to help these people, a lot of times they either just get moved to the long-term side or they will themselves to die. I can't tell you how many people I have seen that say they are giving up and are gone within 2 weeks. There are exceptions to both sides though, obviously. A little afterthought, this isn't necessarily about one's own health as much as it is the health of another person. But I try to share this tidbit whenever I can. Many people are familiar with dementia and Alzheimer's, but not how to handle it. I see it every day with my patients and their families. And I saw this personally with my uncle and my grandma. She had Alzheimer's, she would get confused, upset, and begin to cry. For example, she would ask where her mother was, and get scared and worried when she couldn't find her. My uncle would say something like she's been dead for years. Mom, she died in 1993. This convo and others similar would go on repeat, and each time he told her that her mother was dead, she would cry even more. My uncle would get frustrated with her for repeatedly asking and then crying about it. My grandma had no idea it was 2007. She thought she was in a year where her mother really was still alive, so being told that she was dead was new news to her and upset her. Obviously, the way to handle those situations isn't to reality check. Moderate to advanced dementia, you have to change their thoughts to something positive. You can't argue, reason, or convince someone with advanced dementia. When my grandma would ask me about her mother, I would say something like she had to run to town to get a few things. Can you tell me about her? What does she like to cook? And she would be happy for a while telling me about my great-grandma's best recipes. An hour later she would worry again, and I'd tell her she was out having coffee with a friend. Sometimes she would worry about picking my mom up from the bus stop, so I'd tell her that my mom had to stay after school for Pom Squad practice, and she was catching a ride home with a friend. Had to get creative sometimes. The saying with these diseases is first in, last out. That means their first memories and things they learn are the last to go. Recent memories are lost first. Of course my grandma remembered her mother when she was alive. She had already lost several years of memories and sense of time and would only continue to regress. Ever ask an older person with dementia what year it is? 1948, 1956, 1940, whatever, etc. They always go backwards in their minds. This was especially difficult explaining to my mom. She and my uncle were 15 years apart. My uncle was the elder of the two. For a while, my grandma forgot she had a daughter, but remembered her son. My mom thought she had done something wrong or wasn't there enough, and that's why she couldn't remember her. It's just because she was too far back in her mind already before my mom was born. It was heartbreaking for her. Anyway, my point is, it saves a lot of frustration and bad episodes trying to reality check with dementia. Try to change the negative thought to a positive, even if it's by lying you'll comfort them. Story 33 that things like heart disease and diabetes don't give you a little warning flare when they are still far off. It seems like so many people have a history of these diseases in their family, have bad diets, have bad routines, but feel that they will have plenty of time to change their behavior when they have to. They don't have to think about it now, that somehow they will get some sort of message and then will be able to change their behavior when the time comes, and that's no problem. Story 34 Patient, my gout is really flaring up. Can you help me? Well, Mr. Patient, have you been taking your gout medicine? Patient, well, I recently decided that I was on too much medicine, so I quit taking that one and one of my blood pressure pills. Me take your medication and we can avoid this conversation in the future. Repeat this conversation every month or two. Edit formatting. Story 35 Army medic here. I had a guy come to me with ankle pain. He said it hurt a little when he ran long distances. Because the location of the pain warranted a referral to radiology positive Ottawa rules, I had him sent to get x-rays. Turns out this guy had a broken ankle for like 3 months. That guy is the Army's idea of a perfect soldier. Story 36 Everyone says they know how bad smoking is for you, but it seems like a lot of people don't. I have seen someone dying in almost every medical specialty in various truly horrible ways, and so many of those deaths would have been so much less likely if they didn't smoke. Bladder cancer, mouth and throat cancers, meaning you have to breathe through your neck. Also, it's terrible for your fertility and means you don't qualify for IVF. Also, diabetes is no joke. It's become the oh no, I ate so much cake, I have diabetes, joke of the moment, but people regularly go into kidney failure, go blind young and get infected foot ulcers requiring amputation. Story 37 Changes in seasons do not make you sick. 2. You should wait 10 days for a cold to get better before requesting antibiotics. 3. There is no treatment for acute gastroenteritis, the poops and the pukes, other than time and fluids, so unless you are severely dehydrated and need 4 fluids, don't waste your time going to the doctor. As an urgent care NP, these are the 3 most common things I see every day. Story 38 That vaccines have been extensively tested and are safe and don't cause autism. Vaccination is not part of some massive government conspiracy. And no, herd immunity doesn't work if a high percentage of people don't vaccinate, so terrible diseases will indeed reemerge and put your child at risk for measles, pertussis, lots of other badness. Soapbox. Source pediatrician who loves 95 of my job, but I'm getting frustrated with how many serious vaccine-preventable diseases I've seen lately and how much of my day is taken up by vaccine refusal discussions. Story 39 Eye doc here. Just because you can see clearly does not mean you do not need an eye exam. Tired of seeing the 60-year-old guy who comes in proud of the fact he's never been the eye doctor just to find out he's half-blind from glaucoma. It takes an hour max. Get your eyes checked. Story 40 I work with a lot of heart failure patients. People don't realize that if they are non-compliant with earlier treatments, medication, follow-up, diet and fluid restrictions, later life-saving treatments will not be available to them. We won't give you an LVAD or home infusion if you have 10 years of failing to take your pills. Story 41 Since Lab Week is upon us, let's all acknowledge that what people call medtechs are the folks doing 99% of the diagnosis for the doctors. Sorry patients, your doctor didn't run those tests for sickle cell. I did, and I told him what type of sickle cell you have. Doc said you have leukemia. Guess what, I saw those precursor cells and told him what type of leukemia you have. Here for the medical laboratory scientists. Story 42 I saw one guy who came in 4 days after breaking his ankle. It was a compound wound. When it first happened he saw the bone come out, but when he got hauled to his feet the bone went back inside, so he thought it was fine. After 4 days of bleeding and not being able to walk on it, he thought it was Dr. Time. Story 43 Dear healthcare professionals, please stop calling herpes HSV1 cold sores to make it not sound like herpes. Thank you sincerely, I have herpes on my. Story 44 Poor food choices lead to a waxy substance building up in arteries. If a piece of that waxy the size of the head of a pin breaks off and floats to the wrong spot in your system, you'll have a heart attack, stroke or pulmonary embolism. ITLL kill you within a few seconds or ruin your life at best. Story 45 Being overweight is not good for you. Soda is not as good as water for you. Not knowing why you are taking your meds, not knowing what conditions you have is not good. Story 46 A slightly different situation, as I'm a vet student, not involved in human medicine, but at one of my recent placements we had an owner of phone in to talk to the vet. Her cat was due to come in the next day so we could get a urine sample. The owner had been unsuccessful at collecting a sample herself, so we were going to have to manually express the cat's bladder, or catheterize it, depending on how things went. She wanted to know if we were absolutely sure we couldn't take the urine sample from somewhere other than the cat's bladder. I wasn't the one taking the call myself, so I'm not sure where exactly the woman imagined would be an alternative or what her objection was to us taking it from the bladder. I just got to see the vet's face as she tried to explain that the bladder is pretty much the only place to get pee. Story 47 We went over musculoskeletal medicine journal articles and didactics, and in the literature it says that a large amount of the functional decline in the aging population is due to inactivity. If you move you'll fare better. Story 48 What medication they are on? I need a refill. Okay, what medication would you like to refill? I don't know the name. Do you know what it's for? No, I don't remember. Can't you just refill anything that is available? Well, it looks like we haven't filled anything for you since 2012, so I actually can't fill anything. Ooh. Maybe I got it at a different pharmacy. Click. Story 49. What medication are you on? Blue tablets. What do you take them for? I don't know, the doctor gave them to me. So you're going to theater soon. Do you understand the procedure you are consented for? No, I just signed the form. Do you not know what operation you're having done? No, I trust the doctor though. Story 50. And you waited how long to come to the hospital? That it's a problem if you are coughing, pooping, peeing blood. It's not normal to pass out, wake up on the floor. Things like these are major warning signs and should instantly trigger people to seek medical attention, but many people just ignore them. Story 51. I had a patient who took his blood pressure medicine based on how he felt that day. His BP was through the roof. But he didn't take his pill because he felt fine. I was not prescribing provider. Story 52. That you are no supposed to inject heroin directly into your neck. I had a patient who developed tetraparesis, almost completely paralyzed in all four extremities from injecting into an abscess in her neck, missing the abscess, and infiltrating her spinal canal and cord. Had a completely different patient complain of unexplained left hip pain following injecting heroin into her iliotibial band IT band. Heroin is a horrible, horrible drug. Story 53. I'm always baffled at the relief of not cancer and the inability to foresee the effect other health problems will have on their lives, even if it is spelt out for them. To an elderly patient you have pulmonary fibrosis, which means there is widespread scarring of your lungs which will continue to scar over. We have no drugs to stop it yet and the terrifying breathlessness you have will not go away but will keep getting worse. Oh, that's fine. Thank God it's not cancer. Seriously, there are plenty more horrible diseases to experience. Story 54. Muscle mass is important. If you don't have the muscle mass to command your body weight, you will have bad posture, and that will lead to chronic back issues at age 55 onwards. The most common chief complaint by patients in a doctor's office is pain along the axial spine. Most patients don't know this because most doctors don't either. Or at least they don't focus on it. Story 55. Radiologic CT technologist. When you insert objects into your rectum, make sure you can retrieve them. If the entire object goes in past your sphincter muscle, odds are you will not be able to remove said item on your own. Also, please stop telling us you 1, sat on it or 2, fell on it. You didn't. You stuck it up there to get off, and are embarrassed that you are now in the ER. We don't care what you do in your bedroom, or who you do it with or not. We see this often enough that we have a name for it. Suit something up in there.